The simple steps that follow make about 999 out of 1,000 people successful by the time they stand up. Before you start, please confirm that you don't have implanted electronic devices like a defibrillator, pacemaker, or insulin pump. Number 2, set your wallet, cell phone, and car keys aside. PEMF will erase magnetic strips and car keys and may damage your cell phone. Number 3, remove any metal chains and bracelets. Number 4, please understand that you're about to use an experimental device that is not approved for any purpose by any regulatory agency. Your next step is to pick a treatment area and evaluate before therapy performance. Select any joint with discomfort or limited mobility. Test the joint for discomfort score from 1 to 10 and a mobility limit position. Remember these. The next step tests if you're fragile due to extracellular toxins or severe mineral depletion. This occurs in about 1 in 200 people. You'll place the probe, usually the double loop, over the selected joint. Turn the unit to minimum by turning the intensity knob clockwise. Press the green button to start the PEMF signal for 3 minutes. Rotate the black knob counterclockwise to increase the intensity until you feel the pulse in the joint. Now it's 3 minutes later and we're going to see how you did. Remove the probe from your joint. Test to see if it feels better or worse than before you started. If it feels worse, then stop and pay very close attention to the third part of this presentation. If it feels better, then keep going. Your goal is to improve only the selected area. Many people notice other problem areas during the session. This effect is the reverse of hitting yourself in the hand with a hammer. When a treatment area improves, the brain begins to notice other problems. These other areas will benefit from MagnaPulse therapy later. During treatment, we seek the point of diminishing return, or PDR. This happens when the treatment area has absorbed as much energy as it can use. Please remember that this is your first experience and our goal is communication. We're not trying to cure your problem yet. By now your treatment area will feel somewhat better and definitely not worse than when you started. Next we'll use different orientations or axes and more power to charge the low energy cells in your treatment area. You'll feel your low energy cells charge. This is an electric sensation inside your target area, usually where you tend to feel discomfort. Keep increasing the pulse intensity until you recognize this sensation, but not to discomfort. It's normal for your muscles to twitch at each pulse. The degree of twitching indicates the quality of the cell membranes that surround your motor nerves. If you feel an increase in discomfort, stop immediately. Probe placement is very important. Charging your tissue is like filling an empty glass. When a glass is full, it's time to move to the next. Direction matters. Visualize your treatment area from front to back, side to side, and top to bottom. 3 directions of treatment will produce about 40% more result than a single direction therapy. Maintain the probe in the most sensitive spot and direction. Each third minute when the machine stops, search and reposition the probe for the greatest charging sensation. This simple recipe produces the best result in the shortest time. By now you will have treated your area for only 3 minutes at a low level. This was probably enough to produce a small change in mobility and discomfort, but now we're going to turn it up, literally. Put the probe, usually the double loop, over your area. The unit should be at a comfortable level from before. Press the green button to start the signal for 3 more minutes. Rotate the black knob counterclockwise to increase the intensity until you feel the charging sensation inside. Now adjust the probe position for that maximum sensation. Stay there until the machine stops the 3-minute cycle. The next cycle we'll use a different axis, sideways. Press the green button to start the unit. Rotate the probe 90 degrees on your treatment area and find the maximum effect position. Adjust the intensity for maximum charge sensation, but not discomfort. Hold this position until the cycle ends. The final cycle is long ways. If you're treating an ankle or knee, this will be through the loop. If long ways position is not possible, go back to your first position, and you know what to do. When you finish this cycle, stop. Repeat your initial test to score your discomfort and mobility. If your discomfort is 2 or less and your mobility is improved, then you're done. If your discomfort is lower, but not a 2 or less, repeat the treatment cycle of 6 minutes as before and test again. Continue while your discomfort decreases at least 2 points per cycle. When the reduction stops, you've reached your maximum benefit and you're done with that treatment area until later. At this point, your treatment area probably feels better, but you wonder how long it'll last. Well, if you're in good health, the answer is several days. But a truly correct answer needs an explanation, which is the third part of this presentation.